सलाम दोस्तों, मैं मीसम, आप देख रहे हैं जुरत पाकिस्तान। नाज़रीन, इस वक्त मौजूद हैं हरम इमाम हुसैन अलैहिस्सलाम के बिल्कुल नज़दीक एक बहुत बड़ा मेडिकल कैंप लगाया गया, जो कि मेडिकल कैंप अथॉरिटी ऑफ हेल्थ एंड मेडिकल एजुकेशन की जानिब से, ये पूरा एक डिपार्टमेंट है इराक़ में, जिसकी जानिब से मेडिकल कैंप लगाया गया जो कि ज़ायरीन की खिदमत के लिए हमा वक्त 24/7 ज़ायरीन की खिदमत के लिए ये डॉक्टर्स, मेडिकल टीम का ये पूरा अमला यहाँ पर मौजूद होता है। और ये एक कैंप नहीं, बल्कि ख़ुद अभी हम हेड ऑफ द डिपार्टमेंट से जानेंगे कि वो इस हवाले से क्या कहते हैं और इनको कैसे फैसिलिटेट कर रहे हैं। मेरे साथ मौजूद हैं डॉक्टर हैदर हमज़ा अल आबिदी, जो कि हेड ऑफ डिपार्टमेंट हैं अथॉरिटी ऑफ हेल्थ एंड मेडिकल एजुकेशन के। इनसे बात करेंगे, जानते हैं। अस्सलाम वालेकुम।
Alaikum salam.
हाउ आर यू?
Fine, thank you.
Thank you so much for your time. I just want to ask something from you. How you facilitate the Zaireen of Imam Hussain alayhi salam during Arba'in?
Yeah, let us start with the medical facilities, because if we are talking about the whole facilities, a huge spectrum of facilities from medical to non-medical. We have a lot of departments belong to Imam Hussein Hall Shrine administration with different specialties according to the type of service. If we are talking about the medical services, we have a disaster management health center, which is responsible for the mass gathering management, which is one of our institution in Authority of Health and Medical Education. We have a group of hospitals and universities and rehabilitation centers, and one of those centers are the mass gathering medicine center. Yeah, during any mass gathering, and you know, in Arba'in is the peak of is the most heaviest ziyarah and all over the year. Yeah, we are talking about more than 20 million people within around 7 to 8 days will visit this zone. We are talking not about whole Karbala. We are talking about the zone which is surrounding the Hall Shrine administration, Imam Hussein Hall Shrine administration, which are responsible for this zone especially. We are talking about around 700 meter across. So we have a series of camps and reference hospitals, which is far away, around 3 kilometers from here, from this zone. And in this zone we have a mobile camp. During each ziyara we install those camps with the whole manpower workers in different specialties: logistics, medical and non-medical, nurses and physicians. We are talking about around 1,000 plus volunteer from our employee and external volunteers. All over the year we have a lot of from our friends from Iraq and outside Iraq are joining us during those events to facilitate the services within the same protocol. We are talking about one circle of services. Each camp is connected with other camps. And we have a mobile team with just distributed around Haram and inside Haram, just to have the facility to reach any point within not more than 5 minutes. So those teams are highly trained to interfere with any accident. Actually, within the last 7 days, we received around 47,000, 47 plus thousand. Yeah, huge number. All of facilities are produced and introduced to those patients inside the place, and only around 4 or 5 patients now. They needed to be transferred to the reference hospitals outside the zone. You know, some cases are just like cardiac problems with some of them MI, myocardial infarction. They receive the primary care inside the camps, and after stabilization for 3 to 4 hours, we refer them to the reference hospitals. Others, all of them are treated locally. So after years after year of training and accumulative experience to deal with such an event, now, alhamdulillah, we have a good team to provide such services. Actually, we are excited now to expand our services for a larger zone, because now we have a well-trained team, we have a good experience. So those camps could be a benchmark or role model for other camps outside this zone. And for this year, actually, we have many of our friends from outside Iraq. They joined us actually, with different specialties. Join us with this center.
Dr. Haider, when I came to your office, I saw these two screens which you supervise here. Tell me about which type of data here.
Yeah, we are now here in the control center. Yeah, and Jurat is one of the campuses at the control center. All the logistics and operation are just inspecting and following all any events which is occurring in any of our camps, which are distributed around or inside the haram. So the number of patients, the critical cases, any critical issue from each camp should be notified here urgently, timely. And the logistics team will interfere to deal with. Even the support, we need a supply chain for medical and non-medical, medication, water, or non-medication water, food, facilities. So all of services are inspected and observed from here. And the number of patients also need, and I know at any time I can print a report at any time. And sometimes when I am outside the zone, I just ask them, print report. They send me the report at the current status, so this is the control. I think we are ready now to expand. Because in any expansion, you have to observe and inspect each detail should be provided in the services. Now we developed some of protocols for treatment. Now we have a protocol and we have triad system. And no one can prescribe any medication outside the protocol. The triad system is very important also.
May Allah help you. Appreciate you. Really appreciate you.
Over the year, they are providing a huge services with us.
No doubt, Allah help you. What is your message for the people of the world and the doctors and paramedic staff and other?
Yeah, I think with our vision to expand our services for this center, there will be a good opportunity for any volunteer from outside Iraq to join us. And there will be a link to register as a volunteer with specialties, skills they have, experience to be shared. And it will be a good opportunity to visit Imam Hussein and to be part of this huge project.
जी नाज़रीन किराम, इनका कहना था कि आप यहाँ पर आएँ और देखें कि इतनी बड़ी तादाद में ये फैसिलिटेट कर रहे हैं लोगों को. हम अगर दोनों हाथों से भी नहीं सैल्यूट करें तो मेरे ख्याल में ये. थैंक यू सो मच डॉक्टर.